Now, if you recently just had a knee replacement and you are struggling to lift your leg like this, then stay tuned because we're going to show you the exact exercises that you need to be working on to quickly improve this. Welcome back, guys. It's Dr. Mike, and today we are talking about how to be able to lift your leg after knee surgery, specifically after a knee replacement. Now, many of the patients that I see after this specific procedure struggle and have just frustration with not being able to independently move their leg in and out. And they just feel like, why can't I move my leg on my own? And they struggle with getting in and out of the bed. They struggle with getting in and out of the car independently. And one of the main reasons why patients are struggling with this is simply because you have a nerve block that was placed when you had this procedure. So the entire leg usually loses sensation and loses strength temporarily. Now, after about 3 days after that surgery, you should start to have more feeling in the leg, and you should start to be able to feel more of the muscles contracting, but many of my patients still have difficulty lifting their leg, and that's primarily because of two reasons. Weakness is the number one reason. You have lost a lot of weakness in that leg, especially from not using it, and so it is very easy for that leg to lose strength and you have difficulty moving the leg. The second reason why is because that large muscle group, which is our quadriceps, is a muscle that is primarily responsible for helping us lift that leg up. And that muscle specifically is also inhibited. It's shut off because of pain, because of the inflammation in the knee from the surgery. And that is okay. There's nothing wrong with that. But it is our job now to start working on exercises that are going to wake up that quadricep muscle group, as well as activate the muscle group so that you can be able to move the leg efficiently on your own. Now, I'm going to show you what I typically give to my patients, and it's a step-by-step process, and you have to complete one exercise successfully before you move on to the next. So make sure you watch all the way to the end so you get all of the exercises that you need to be working on here. So the first exercise that I provide for patients is a simple isometric quad set. Now, that may sound very simple, and many of us have heard the exercise where we're just squeezing the quadricep muscle, and I've shown this on many of my other videos on my surgery series where I go over just how to contract that muscle. But this one is extremely important because I like doing this sitting up, because now you can visually see the muscle activating. If you cannot activate that muscle just with this first phase 1 exercise, you're not going to be able to move on to the next exercises, and you're not going to be able to move your leg at all. So this is why this first exercise, which is the quad set or isometric set, where we're really visually watching our leg contract, we're seeing all the muscles squeeze together, that is extremely important. Now, not just squeezing where we just squeeze and let go, squeeze and let go. I see many of my patients that start off this exercise and they say, yeah, I'm doing this just fine, and all they're doing is activating it. But I really want you to focus on the hold. The longer you can hold it, the more you can facilitate all of those muscles around the knee, and it's going to be imperative, and you'll see over time that you're going to develop more control on the leg. So instead of you just squeezing it, let's have you focus on 5 to 10 second holds, which means you're going to watch, visually see the muscle contract, and you're going to hold it there for 1, 2, 3, and you're going to count all the way to 5 to 10 seconds, and then you can relax. I usually will recommend about 10 repetitions at a time for anywhere between 2 or 3 sets. So yes, that's about 20 to 30 repetitions of practicing this exercise before we move on to the next exercise. Now, after my patients have demonstrated that they can easily complete those repetitions, holding on for 5 to 10 seconds at a time, they're able to show great contraction of the quad, and they're doing 10, 20 reps with ease. We're going to move on to the next exercise, which is a short arc quad. Now we're going to start to get some movement of the leg while still contracting that quadricep muscle. I'm going to use something like this, which is a half foam roller. I've seen sometimes that we can roll up a beach towel, place it underneath the knee. But what I really like the foam roller is because it prevents the foam roller from sinking too far deep, and just provides a firm surface for me to complete this exercise. Now, the short arc quad is nice because I'm still focusing on really activating the quadricep muscle, But now what I tell my patients is, let's see if you can lift your heel up off the bed. We're not moving the whole leg. We're not doing a single straight leg raise just yet, but really you're focusing on, can you get your heel off? Can you get your knee fully straight? And I tell my patients to point those toes backward so that they can really facilitate the quadricep muscle. Now we're not done just yet. You're going to slowly lower all the way down. That quad muscle is going to work eccentrically, meaning we're getting a nice good stretch and we're strengthening that muscle at the same time. The same idea with this exercise. If you can perform about 2 sets of about 10 repetitions where you're really focusing on that nice slow control, then you're going to be ready to move on to the next exercise, which is now we want to start to get more movement. And once the short arc quad exercise becomes too easy, then we can start to move people to the edge of the bed. And we're going to focus on increasing the range of motion of the knee. So now I will have patients go through the long arc quad. And this is basically when we are sitting up nice and tall, and instead of us just sitting down, moving our leg through smaller ranges of motion, the long arc quad is very similar like the leg extension machine that we see at the gym. It's going to require your lower leg to move higher up, and you're going to take that knee through greater range of motion. So basically you're practicing extending the leg up, bringing the toes all the way back to get a nice full contraction of the thigh, and then lowering down nice and slow. We don't want to go too fast with this. We really want to show good control. And our goal with this exercise is to be able to perform 2 to 3 sets of about 10 repetitions at a time. Now, once you have mastered the long arc quad, we're going to now progress to the last exercise, which is the most difficult for many people, but it can be so crucial when it comes to being able to really lift your leg confidently. Now, what you're going to do here is you're going to be sitting up at the edge of the bed. And the reason why this is so important is when you lift your leg, you not only have to have strength in your quadricep muscle, but you also have to have strength in your hip muscles. And many people forget about this. And that's why the straight leg raise is such a great exercise to start incorporating after you've gone through your phase 1, 2, and 3 exercises that we've gone over early in this video. And what you're going to do is you're going to initiate the exercise by squeezing the quad muscle, keeping the leg completely straight. And all you're going to do is you're going to lift the leg up as much as you can. Now, the key with this exercise is not about how high you can lift it, but it's really about how much you can keep the leg straight and how high you can go at least a few inches up off the bed. What I commonly see patients think that they're doing really well with is that they'll just lift their leg after surgery and they'll say, wow, I have really good strength in my leg. I can lift my leg on my own. And although that's great after surgery, it's not truly beneficial unless you can really lock out that leg out, because this is what's going to truly show us how much quadricep strength you have in the leg to be able to move your leg in and out just like so. So when we're performing this straight leg raise, once again, keep the leg straight, activate that quad muscle, pull those toes back, and once again, we're working on 2 to 3 sets of about 10 repetitions. Now that is a step-by-step progression of the exercises that you really need to work on and go through before you're able to independently raise your leg on your own. And you'll see after working on each progression that that leg will feel stronger and you'll be able to have no limitations with moving your leg in and out of bed or moving your leg in and out of a car. Now, if you're someone that is still struggling to activate that quad muscle, maybe you've gone through all of the exercises in this video and you're still having a difficult time really squeezing that quad muscle, I made a great video on the benefits of neuromuscular re-education devices and how this device can be very helpful for some people. So if you want to learn more about how this device can help you, make sure to watch the next video here.